Stephanie Belflint joins us now to talk about aortic stenosis. If you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is interventional cardiologist Dr. William Crowder. He's with Baptist Medical Center in Jackson Hart. Thank you so much for joining us.
Yes, ma'am.
Nobody probably knows what aortic stenosis is, but somebody with it.
Well, that's a good point.
What is it?
Aortic valve stenosis deals with the heart valve. A valve is like a little gate that opens and closes. So with each heartbeat, this gate opens and lets blood go out to your body. We have 4 of them in our heart. The aortic valve is the one that is the gatekeeper to the rest of the body. So it lets blood go into the aorta, which we know is the big blood vessel that supplies your whole body with blood. So when it becomes dysfunctional, people really know it. They can feel it with symptoms that are shortness of breath, passing out, or even chest pain that we traditionally associated with blockage. So it is quite a frequent finding when we do echocardiograms.
Now, for someone who seems to be relatively healthy, takes care of themselves and this kind of thing, a lot of times we tend to say, I know my heart is good, my cholesterol is low, this kind of thing, but anyone could be a victim of this potentially. Is that correct?
Well, that's true. A lot of the same risk factors, and when I come on, I talk about risk factors, the smoking, blood pressure, cholesterol problems. These are all risk factors for development of aortic valve stenosis. But sometimes we start out with a congenitally abnormal so-called a bicuspid aortic valve, where there are only 2 valve leaflets instead of 3, that can predispose one to a more rapid accumulation of calcium and more rapid decline in that function. Now, traditionally, this has just been something that's treated with open heart surgery. The patient population that we're talking about today are those who are very sick from other medical problems and might not be a good candidate for surgery. Open heart surgery is a big deal, obviously, and not everybody can survive it. If you have bad lung disease, other medical conditions that make you high risk for having that big operation, previously there had not been a lot of hope until now. And
so what are you going to do for this?
We have been approved to start enrolling patients into a transcatheter heart valve program, and that's what we're so excited about. This is technology that allows you to do an aortic valve replacement through a catheter going into your leg, just like a regular heart cath. It's a little bit bigger, but it takes a lot of the other risks that are associated with surgery out of the picture. And so we're real excited to roll out that technology for folks that are having problems with their aortic valve and don't have the, I guess, medical conditions that preclude them from having surgery. This is an option for them.
Well, is it a first option at any point, or right now is it just a last option?
That's an excellent question. Right now, as far as what the FDA has indicated, this is for people that are not able to have an operation, so-called inoperable patients. This will change over the next few months as we get more information about the valve. It's been studied extensively, and that's why it's already come to market, but to include the high-risk patients, and that's what you're talking about, whether it's just, I don't want to have surgery, I want to have this procedure done. We're not there yet. It's reserved just for the patients that are not able to be operated on. But it can be the difference between night and day as far as their symptoms. They go in, have this procedure done, and the aortic valve is replaced, and recovery time's a lot less, and the patients that are getting this thing done literally have a new lease on life because of the technology. This is the one part of our job where it's really good to offer new technology and help people, most importantly, get these things done where in the past they couldn't.
Pretty big news there.
It really is.
Big stuff.
Now, you're partnering with Baptist Hospital to do this. So now, what are some of the symptoms? You mentioned some of the precursors, smoking. What are some of the symptoms that people need to watch out for before they
If the patient has been told they have a murmur is a sound that we hear with a stethoscope. It's the sound of blood rushing through a diseased heart valve. Not all murmurs are bad, but they need to be evaluated further. The typical next step is to get an ultrasound of your heart, to actually look at the heart valves opening and closing. Symptoms can be shortness of breath, passing out spells, dizziness, chest pain. These are all symptoms that can be associated with not just heart valve problems, but heart failure or blockages that we talk about all the time. And yes, the Jackson Heart Clinic is partnering with Baptist to open a valve clinic, a clinic that specifically looks at these issues of heart valve disease, people that have had murmurs and need to be more closely watched or have more testing done. We have a protocol to find patients that might need the traditional operation like we were talking about, or who might fit into this new category and get this new technology. So exciting times in the heart world.
Apparently so. So I suppose that someone's out here watching this today. Could they talk to their cardiologist about, would their cardiologist know if they would be a good candidate for this?
They would. This has been circulating in the heart world for a little over a year, and the technology, everybody knows it's coming, but it's here now. And so cardiologists, primary care providers, and we're trying to get the word out for patients who might fit into that category, have their doctor call us or have the patient call us if they have questions, and let us know what we can do to help them out. But cardiologists should know about this and be looking for patients that might fit these criteria.
Wow, this is a group that actually could be ineligible for a corrective procedure otherwise, right?
Absolutely. Wow. These have been, they've just been sitting waiting for something, and that is here now.
All right, Dr. William Crowder with Jackson Heart, thank you so much.
Thank you.